Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In angle closure glaucoma, with if the patient has angle closure glaucoma with either primary angle closure suspect or if the patient has primary angle closure. Okay, in both these conditions, first and foremost, the patient is asymptomatic, but he can have some complaints of halos around the lights can be seen, with transient haziness of the vision may be seen in the patient. Now, this occurs only and only when some part of eye angle is closed, that is, when the pupil is mid dilated, and then once the uh, angle opens, then there will be no symptoms. Okay, so only during the closure the patient will have pupil mid dilated and the symptoms will be seen like halos around the eyes and transient vision. But when the angle is open, then there is no symptoms, that is, eye is white and quiet. So this is called as either this is seen in either primary angle closure suspect or primary angle closure.
thank you and thank you for watching.